I was not able to walk probably 3 houses without being in such severe pain. And thank goodness for Mayo Clinic.
I had excruciating knee pain, and I had really decompensated to the point where every day was a really big struggle. I mean, my knee was dictating essentially what I could do every day.
I didn't think, my husband and I both didn't think that we'd be able to afford Mayo Clinic.
Well, we entered into an agreement with the Mayo Clinic here in Jacksonville where we would pay one single fee for a knee replacement. That's referred to in the industry often as a bundled payment.
The value of the bundled payment means there's less administrative kind of hassle with the bill and the way the payment is, and their out-of-pocket expense is less. They're going to get the same care from us, whether they're in the bundled payment pilot or they have a different insurance plan, but the process for the patient in terms of out-of-pocket expense and their kind of administrative process is easier.
This benefits our customers in a number of ways. First of all, it creates a much better member experience. By not having to work through basically explanation of benefits for each service that they had, separate co-payments, coordination of the care while they're going through this episode of care, it's a much more seamless experience for them.
My care and my access to care was seamless. I didn't really have to do anything. All I had to do was show up for my appointments. I didn't have to worry about my insurance coverage, my co-pays. Getting back to some of the activities that I was able to do before I had to have the 3 surgeries.
We're focused on quality, safety, and value, and we know that we need value. We need to provide value so that our insurance partners are going to encourage patients to experience the care that we can provide for them. It's a win-win for us. It allows more patients to come to Mayo, experience our safe care. I think it's a plus for the insurers because they get more satisfied patients with better outcomes, fewer infections, lower readmissions. These are very important things in terms of not only the impact for the patient and their family individually, but to the insurer in terms of cost.
I consider Blue Cross and Blue Shield to be a top-notch insurance company. It's always my insurance company of choice. But when you couple that with the level of care that I received here at Mayo, I just don't know how you can get any better than that.
The surgeries have allowed me to just get my whole sense of life back. I'm able to get back to exercise, gardening. I can get on my hands and knees and I can get up. I could not do that before. I am so grateful for all that Mayo has done for me.